Wilson's disease is a very serious disease. I've gained interest in this disease through my courses of biology in college. Throughout this speech, I'm going to inform you all about the history, the causes, and the diagnosis and treatments for Wilson's disease. Here are some facts about the history of Wilson's disease. Wilson's disease was described by Dr. Samuel Alexander Kinnear Wilson in 1912, hence where the name of the disease came from. Wilson was a neurologist who studied the pathological changes in the organs of the body. He noticed while examining the pathological changes that there was an excess amount of copper in the body that was unable to be removed. What is Wilson's disease? Wilson's disease is a genetic disease involving the inability of the body to remove excess copper. Under normal physiological conditions, the liver filters excess copper and releases it into the bile fluid to be excreted from the body. People with Wilson's disease are not able to filter the copper sufficiently in the liver, and copper levels build up in organs such as liver, brain, and the eyes. This disease tends to run in families and occurs in 1 to 4 per 100,000 people. Wilson disease normally appears somewhere between the ages of 6 and 20, although for a small portion of patients it may occur later in life. The ATP-ZB gene is present in 1 out of 100 people. Now on to the causes of the Wilson disease. Wilson's disease is caused by a mutation in the ATP7B gene, which is inherited from parents in an autosomal recessive pattern. Both of the parents must carry the gene. Most of the parents must be carriers of the defective gene for the child to be affected, and males and females are both equally susceptible to the disease. This is a chart where both parents are heterozygous dominant, and it just shows you that their offspring, they're both carriers of the gene and their offsprings. It's a 1 out of 4 chance for the kid to be have normal genes, and 2 out of 4 of the kids will be carriers, and then only 1 out of 4 of the kids will have Wilson's disease. And there are many symptoms of Wilson's disease that can be easily detected, and here's a guy with Wilson's disease, and here's some of the symptoms. They have difficulty speaking, excess salivation, ataxia, mask-like faces, clumsiness with the hands, personality changes, spasticity, grand mal seizures, their self-injurious behavior, and flexion contractures. And here are some of the ways to be diagnosed and treated for Wilson's disease. If a physician suspects Wilson's disease based on the presenting signs and symptoms of a patient, a full medical and family history should be taken. A physical examination should be taken, specifically looking for the presence of Kaiser-Fletcher rings in the eyes and listening to the abdomen with a stethoscope. And those Kaiser-Fletcher rings where a doctor can actually see copper color around the normal color of your eyes, and that's one way to be diagnosed. And they can do blood and urine samples to check the copper levels, and then a liver biopsy can help to confirm the diagnosis by showing signs of cirrhosis and copper in the liver. Wilson's disease is treatable. With proper therapy, disease progress can be halted, and oftentimes symptoms can be improved. Treatment is aimed at removing excess accumulated copper and preventing its reaccumulation. Treatment for Wilson's disease is a lifelong process. Patients may be progressively sicker from day to day, so immediate treatment can be critical, and treatment delays may cause irreversible damage. You can also take medicines for it, such as penicillamine, which is it binds the copper, causing an increase of urinary excretion, or you can take Galzin, which depletes accumulated copper and prevents its reaccumulation. And it is a lifelong treatment, and if you take any breaks, it can be severe and rise back up bad. And after pointing out all the main facts about Wilson's disease, you now should understand the history, the causes, and the diagnosis and treatments of Wilson's disease. As Paul Dudley White once said, we know from our clinical experience in the practice of medicine that in diagnosis, prognosis, and treatment, the individual and his background of heredity are just as important, if not more so, as the disease itself. That's it.
Yeah.